Hello everyone, I am Noor Alam, PhD student, Department of Electronic Engineering, Kwangwon University. Today, I will present the paper Ultra Fast and Recyclable DNA Biosensor for the Point of Care Detection of SARS-CoV-2. The motivation behind this work is need for rapid COVID-19 diagnostics. RT-PCR is accurate, but it takes time, needs thermal cycling, skilled operators, and specialized equipment. This paper aims to build a sensor that can detect SARS-CoV-2 more quickly within amplifications using a simple electrical signal. Some symptoms of SARS-CoV-2 virus and risk factors are shown in this figure, in this slide. Also, this figure presents structural elements of the virus. There are some current detection techniques such as PCR, commercial PCR-based system, emerging biosensor technologies, but those methods have some limitations. For for this reason, the main objective was to develop a real-time, low-cost DNA biosensor capable of detecting SARS-CoV-2 RNA-dependent RNA-based gene with high sensitivity. Additionally, researchers wanted to sensor to be usable so it could be recycled multiple times without losing accuracy. In short, the design combines electrical engineering with molecular biology to achieve practical virus detection. This slide shows the working principle of biosensor. The device uses integrated platinum titanium electrode on glass substrate. The surface is modified with aptech to introduce amino group that can bind to the probe DNA. When the targeted complementary DNA from SARS-CoV-2 hybridize with the probe, the electrical double layer at the electrode surface changes. These changes alter the capacitance, which can be measured easily. No fluorescent or enzymatic levels are needed, which simplifies the process and reduces the cost. This slide shows materials and equipment which will be needed for detection of SARS-CoV-2. Here SARS-CoV-2 gene, which is essential for this research, and some reagent including sulfuric acid, hydrogen peroxide, ethanol, and PBS, which will be used in this work. Preparation of aptamer are shown here step by step. The optimization setup is important because the sensor's stability depends on the quality of aptech layer. The detection level is free. Capacitance is measured at low frequency around 10 Hz. This paper optimized the aptech layer using ATR, FTIR. Different pH value affect the stability of silent layer. Neutral pH provide the best functionalization surface, ensuring strong probe attachment. This optimization step is important because the sensor stability depends on the quality of aptech layer. To verify specifically, the compared SARS-CoV-2 DNA with SARS-CoV DNA, which contain 4 mismatches. Fluorescence imaging and capacitance measure both showed strong signal for exact complementary sequence, minimal response for mismatched sequence. This proved that biosensor can differentiate SARS-CoV-2 from closely related viral sequence. One of the strongest outcome of this arc is recyclability and sensitivity. After its detection, they wash the surface to remove hybridized DNA. The sensor was then reused for next cycle. They repeated this for 15 cycle and the capacitance signal remain stable. This reduces cost and make the sensor more practical for point of care use. The full workflow includes extracting RNA from patient sample, converting it to cDNA, direct detection using IDE biosensor. The intersensing step take only a few minutes. This make it compatible with point of care testing where turnaround times matter. This figure highlights a major strength of this sensor. The device was reused for 15 cycles, 3 measurements were tracked. After uptake capacitance remained stable for all 15 cycles. After probe immobilization, again very stable values showing the probe layer can be regenerated. Detection signal, its cycle still showed a clear jump in capacitance after SARS-CoV-2 binding. This means the sensor maintains its performance, save cost, and is suitable for repeated point of care use. To conclude, this research developed a DNA biosensor that detects SARS-CoV-2 rapidly through capacitance changes on IDE sensor surface. It is highly selective, work without level or amplification, and can be reused at least 15 times. This creates a strong foundation for point of care diagnosis, especially during outbreaks when speed and cost are critical. Thank you everyone for your kind attention.